Thank you for your kind presentation. So, as you have already mentioned, my name is Mariana. I am here in representation of SPMS, which is a Portuguese governmental institution that aims to provide services, shared services to health organizations in order to centralize and to optimize the procurement of goods within our health system. Today, I will briefly talk about our experience on building solutions that enable patient centricity by the hand of our national mobile application SNS 24, as well as the foundations and the relevant steps that are attached to this journey. So in terms of framework, we believe it is important to highlight the path that the Portuguese Health Ministry and SPMS have been doing along the last decade that honestly has allowed us to be here today and to have a set of digital tools to answer the needs and the challenges of e-health. So generically, this path started in 2007 with the creation of our national health telephone line, at the date still at a basic level, attending mainly pediatrics and pregnancy issues, followed by, in 2012, the launch of our Citizens Portal. Then in 2016, our National Telecenter Health was formally created, and in 2017, the National Phone Line has evolved to a specialized contact center, attending both clinical and administrative issues at a distance of a phone call. In 2017, we have also launched the first version of our mobile application, which is an app that intends to be a mobile version of the patient's electronic health record, and that I will briefly present afterwards. In addition to this, and more recently, it is also relevant to refer the launch of our teleconsultation platform just last year. And regarding 2021, the deployment of a national telemonitoring platform, and also the kickoff of an initiative, a governmental initiative that aims to align the digital health services available to our citizens. So along with this strategic and implementation path, it is also relevant to analyze the dynamics and the paths that the citizens take when seeking healthcare. So as we try to illustrate here, these routes are very heterogeneous and have changed a lot over the past years, showing us that care is nowadays provided within an extended network, as opposed to what happened before, which was mainly between four walls and within a doctor's office. So we understand, we believe we need to face this curve as both a challenge and also an opportunity, trying to create new ways to address digital transformation while redefining and trying to improve some fundamental health processes. In terms of e-health tools that promote the concept of patient centricity, I will briefly present our mobile application, NHS 24 or SNS 24, which is fully dedicated to the citizen, and that is currently available in these 3 app stores, so Android, iOS, and Huawei. The main purpose of this app is to provide useful information and health services to our citizens anywhere, anytime, and within a secure manner. As I have already mentioned, we have launched the first version of our mobile application in January 2017, and then this year in late June, we released a new version of it. So this upgraded version is part of a strategy to bring the citizen closer to the health system, and one of the main features that we made available in June 21 was the access to the digital COVID certificate. In addition to this, and as you can also verify here, we have invested a big effort in the user experience and in the user interface components, as we understand that these are fundamental aspects in mobile applications these days. So regarding the mobile app, as a way to grant access to health data. The main services available to our citizens at this moment are, of course, the access to the European Union digital COVID-19 certificate, the access to one's immunization records, prescriptions, allergies, to a registered living will, rare diseases, and also a set of identification information within the NHS. In addition to this, we also provide a set of specific transactional services, like the possibility to record health measures that will later be shared with the healthcare professionals, the possibility to perform a teleconsultation, or the option to renew, to ask for the renewal of chronic medication. So if you have a record of a chronic medication within our system, in the mobile application, you can request it's renewed to your practitioner. In terms of metrics, we have aggregated here our most relevant services, and also a comparison between the usage before and after the release of this new version. It is notorious we have had a great boom, essentially due to the COVID-19 certificate, but it is also curious to realize that people are now discovering and getting interest with many features that we already had, but that people probably did not know about. So we are trying to face this chance and this great access to disseminate our work. And we have been noticing that people actually do want and do need to access their data, and are now discovering that it is normal. Some of their data are not correct, are not updated within the health system, and we are verifying a great interest in this matter. For example, in terms of accesses, before this release, before the COVID-19 certificate, we used
Mariana,
to have—
1 minute.
Okay, yes, I'm almost finishing. We used to have about 800 accesses a day to the immunization record. Now we have around 30,000. So we are seeing the interest. At last, and considering our consent to keep providing useful services to our citizens, I will just share our ideas for the next months regarding the mobile application, namely the possibility to have targeted notifications, an embedded calendar with health events, the implementation of health programs like weight control or smoking control, the inclusion of exam results, or the possibility to manage authorizations and consents regarding data access. And this is all. Thank you, Sarah.